Hi everyone, welcome to St Mary's College and to Psychology, and welcome to the taste today, which I'm hoping you are going to enjoy. I'm sure you're going to love it here at St Mary's College, and I'm hoping that you're all ready and eager to learn. So this presentation is a quick introduction into one of the subjects that you're going to study in psychology, which is psychopathy. So we're going to briefly have a look at some areas within psychopathy, however not in too much detail, of course. We will look into this further when you come to study it. And hopefully you're going to have a bit of fun with this lesson and with the task that I've set for you all. Okay, so I'm going to dive straight into the lesson where I will be explaining abnormality, some of the ways in which we can define abnormality, and explaining the task itself to you. So keep an eye out for the speaker button, as I will be explaining the slides and the tasks through this button. Okay. So the first question that I'm going to ask is, what is normal? How would you describe normal? There's a number of ways in which you could describe this. It's quite difficult to define. Also, abnormality, which is of course the opposite of normal, again is quite difficult to define. There's so many causes of abnormality, such as physiology, so that's where your biopsychology kind of comes into it, cognitive factors, or even social stressors, so things outside of our control, our experiences. These can all be things that can cause abnormality. So this is one of the reasons why psychologists find it quite difficult to define abnormality. So we're going to look at why this is so. So we're going to briefly look at it in this presentation, and again we're going to look at it in a lot more further detail when you come to study psychology and abnormality and psychopathy. So looking at these pictures here, you might recognise a few faces. So we have Elton John, we have David Beckham, we have Angelina Jolie, Stephen Fry, Orlando Bloom, and one of the Olsen twins, I think it's Mary-Kate Olsen, that we have here. And you might be wondering why these people are in a presentation that is related to psychopathy and abnormality. Okay, so the reason I've put these people here is to demonstrate how difficult it is to define abnormality and to recognise abnormality. You wouldn't necessarily think that David Beckham has any kind of abnormalities or could be defined as abnormal in any way. However, if you have a look at the next slide, you will see why this isn't the case and why these people can be defined as abnormal in some way. So as you can see here with the definitions underneath the pictures, you can see why I would include these celebrities in this presentation. They all have something similar, they all suffer with some kind of disorder or condition or illness. And it's not something that you would necessarily recognise simply from looking at a person. So that is one of the reasons why it can be so difficult to define abnormality. It's not something that we necessarily spot instantly. So with abnormality being so difficult to define, it would only really make sense that there are a few different definitions within psychology that we do look at. So three of the definitions of abnormality that we do look at are deviation from social norms, failure to function adequately, and deviation from ideal mental health. Now these kind of are explained in the names really. So deviation from social norms would be deviating from what society perceive as a normal behaviour. So for example, not being nude in public places, etc. So failure to function adequately would be when your behaviours stop you from functioning normally in day-to-day life. So this may be that your behaviour is affecting your hygiene or your nutrition, so you're not washing properly, you're not eating properly, that kind of thing. The last definition that we're going to look at is deviation from ideal mental health, which would mean that you score lower on certain normal behaviours. So for example, you may have a very low opinion of yourself, you may not be able to kind of resist stress as well as other people, and you may not necessarily have an accurate perception of reality. So now that we've discovered that abnormality is something that is quite difficult to define, we've also looked at some of the definitions that we do look at in psychology of defining abnormality. Now I want to quickly go through with you some of the issues defining abnormality. So as you can imagine, the word itself, abnormality, isn't necessarily the nicest term to use to describe someone who is suffering with the mental health. Obviously abnormal doesn't necessarily sound very nice, does it? So that can be one of the issues in itself. Another of the issues with defining abnormality is, as we've discussed, what is normal. So cultural differences can come into play here. So what one culture may perceive as something normal might not necessarily be the same in another culture, and so on. Also, the passing of time as well. So normal behaviours can kind of change over time. So what may not be seen as normal 50 years ago may be seen as normal now, if that makes sense. So there are a number of kind of issues with defining abnormality. So that's important to recognise as well. So if you look at these disorders that are in front of you now, I want you to think about a couple of things. So what is the disorder and what might have caused this disorder itself? So there are a number of things that can influence the development of these disorders, and it's not necessarily that one is correct and one isn't, but there are a number of approaches that you can take when looking at disorders. So that is something that we do look at within the topic. We also look at treatments of these disorders also, and different types of treatments. So we're always looking at different thoughts, different theories, and that's really what makes psychology so interesting. So here we have 4 of the key explanations to explain abnormal behaviour, which you may have already started to look into with the last presentation that I actually did for you all, where I asked you to have a look into different key approaches. So we have behavioural explanations, so things like your experiences throughout your life, learned behaviours that you may have learned from other people, and from witnessing things yourself throughout your life. We have biological, which of course explains itself with the name biological. We look at the biological approach to abnormal behaviour. We also look at the cognitive approach to abnormal behaviour, and we look at the psychodynamic approach to abnormal behaviour, which is all linked with a psychologist called Sigmund Freud, who looks at something called the id, the ego and the superego. He looks at your unconscious mind and things that you don't necessarily think are influencing your behaviour, which is very, very interesting also. So we look at these within the topic. I'm not going to really touch on them now, but it is definitely something that you can be looking into over the summer before you start here at St Mary's College. Okay, so here's the fun bit, here's the activity. What I want you to do, guys, is have a look at the following slides that contain fictional characters that you might be familiar with. Hopefully you will be familiar with at least a few of these characters. So what I want you to do is use the definitions and the symptoms on the slides after the pictures, relating to different types of mental disorders, to diagnose these characters with a mental disorder based on their behaviours. So do as many as you can. You can use the internet if you need to, however I do think you'll be able to have a go at this on at least a few of the characters without any help. So have fun guys, and the next presentation will be going through the answers with you as well. Okay.